Hey guys! Welcome to CJPT Happy Hour. I swear if we have not had a sip yet. This is Bodhi. I'm Dr. Carrie, and this is Dr. Jessie. So we used to do this series a while back, and we got away from it, but we decided now is a great time to bring it back. So today, since we know so many of you are stuck at home, we thought a good topic would be to talk about ways to save your back and tips to try to keep your back from getting so stiff and painful. You know, because we know so many of you are stuck at home, you're off your routines, like you might not have the same work set up at home. Bodhi likes to, tap dance and distract. But before we can get started, if you feel like grabbing a glass of wine and joining us, go ahead and do that. But we're going to do a virtual cheers. So we're sitting so far apart because we're practicing our social distancing. We have been open here. Dr. Jessie and myself have been the only ones, and Bodhi, the only ones coming into the office. We're considered essential healthcare providers. So we've been helping people come in and, Bodhi, we're doing that because, the worst thing that could happen is you get in terrible pain, you have nowhere to go, and then you end up having to go to the doctor's office or worse, the ER, which is really not a good place to have to be right now. So we're staying open and seeing clients in-house. But a lot of our clients have switched over to virtual, which has been pretty cool. And we've switched all our Pilates over to virtual. So, so that's just a little bit about what's been going on. What we thought we'd talk about today, though, is, like I said, tips that you can do at home, or just some of the things that we've been hearing, and how we've been helping people virtually who've been having back trouble. So Dr. Jessie's been actually doing most of that. She is our main PT, and she works with most of our clients. So Jessie, tell me, what has kind of been, since all of this stuff started happening and people have been stuck at home more, what has been either the biggest complaint or even new complaints that you're hearing that maybe you didn't hear as much before?
Yeah, I think back pain is probably our number one main complaint. We have heard some neck pain and things like that, and a lot of it comes down to people doing different things at home than they normally would at their normal workplace, right? So they're working at their workstations at home, which might not be ideal. Sometimes they don't even have a workstation at home, so they're sitting on the couch, or they're sort of moving from room to room, so that can definitely contribute. And people, I think, are just generally less active and less mobile because, to be honest, we can't really get out and do too much. So I think that's one of the biggest complaints is just back pain, and then along with back pain often comes that dreaded sciatica or leg pain, and that can happen pretty quickly as well for people.
So you've been working with clients both in person, like we normally would, but then you've also switched a lot of people over to telehealth.
Yeah.
How's that been going for you? Like, maybe tell me from the PT side of things how that's been for you, and then what the patients have been saying about that experience.
Yeah, so I think telehealth was maybe not something that I ever thought that I would really do, but to be honest, I really like it, and I feel like it's a lot more effective than I even thought it could be. I understand when people have reservations about not being able to come in and have the physical things done, but I actually think that it's a great way for us to just keep things on track during this kind of weird time. And clients kind of feel the same way, so they've really all given me great feedback in terms of it being helpful. And the biggest thing is a lot of times people don't know what to do when they're in pain, and that consultation piece of the telehealth is really where we shine. So it's not just logging on and doing a bunch of exercises. It's really like us guiding you and kind of giving you the right things to be doing. So that's what's most valuable, I think, about being able to continue to do it.
Can you tell me what are some advantages that you found being able to see people in their homes versus coming in person to the office?
Yeah, so a few people I've been able to take a look at their workstations. So a couple of them are people who actually do work from home like half of the time, and normally, sometimes I'll tell people to take a picture, but everyone forgets, and so it was actually really nice on the virtual session to be able to take a look at that, and then make recommendations on how they should set things up, and where their lumbar roll should be, and just kind of like the things to think about, within their home environment. Also, it's nice to know what equipment they have because I can better guide them, in what exercises and things they can do at home to stay moving.
Cool. Have you had anyone that was nervous about doing telehealth that has decided to do it? Tell me about that, and then maybe what they ended up saying about it.
Yeah, I think that sometimes the nerves come from just the technology piece of it and just not knowing how that's going to work. But honestly, once we get it all set up, it's easy. And I've had a couple people, say that it's just been really helpful for them to sort of like continue to be accountable, and then also get a good idea whether they're doing their exercises correctly, or if there's anything else that we need to either add or change about their program. We're able to do that very seamlessly on a telehealth visit, which is great. I think the biggest thing is I saw someone recently who just said she felt like she was in pain and she was really frustrated about it, but she felt like there was nowhere for her to go. So again, like Carrie said, there's, you don't necessarily want to go to the doctor's office right now. You don't necessarily want to go to the ER, and I don't want you to go there either. So if virtual is the best option for us right now, I can tell you that it's still going to be worth your time.
Has anyone, I know a lot of people were worried at first about, how do they, a lot of times we do with physical therapists, right? We do put our hands on people. So clearly we can't put our hands on you if you're at home. So I know that was one of the biggest things that people were worried about. They didn't think it would be worth it. They just didn't think it would really help by doing the sessions at home versus coming in here. So how have you handled that, and what have the patients been saying about it?
Yeah, I think that what I've been telling people when they have that reservation is just that our job as PTs is to empower our patients, right? So this sort of forces that, even more so than if you're coming in to see me. And I've told Carrie it actually sometimes feels a little bit like more work for me to do a virtual session, in a good way, makes me think more, but sometimes we use those physical treatments like massage and dry needling, things like that, to sort of like help the process along, but like, what if we didn't have those, So this forces us to think in that manner, which is a great way to kind of let patients sort of take it into their own hands and then just have us help them sort of steer the ship.
And tell me, so what about clients that have said, I can just look up the exercises and do them on my own. You already taught me exercises, so I can just keep doing them. What has been that kind of conversation like, and why should they come in? Why should they work with you virtually when they could just do the exercises we already gave them? Because we give all our clients video exercises anyway. Yeah. So tell me why you think it's still important for them to do the telehealth and keep up with the appointments.
Yeah, so there's a couple of benefits. So one of our big hallmarks for treatment here is that we try to give you some movement medicine, right? So this is a movement that you take as your medicine whenever you're having pain. But sometimes your pain can start to behave in different ways, and it can be hard to know whether you're doing the exercise correctly. It can be hard to know whether you're doing it frequently enough. It can be hard to know if you're using it correctly. So that's one way that we can really help out a lot, is because we can have you do a few movements and we can sort of do a little assessment, right? So we can get an idea of where your pain is and what we can do to intervene. The other thing that's really useful is just, yes, you can do the exercises at home, but if you don't have a pair of eyes looking at you, it's hard to know, one, whether you're doing them correctly, or two, whether you're thinking about everything you need to think about. So it could be as simple as we give you a strengthening exercise like a band pull, but if you're doing it like this, you might be perpetuating your problem, and it's a simple cue, but it's worth it to really make sure you're doing everything correctly and getting the most out of your program. And then we can also progress the exercises. So who knows how long this is all going to go on? Does anyone want to do the same exact exercises for 6 weeks? By that point, they're going to probably feel pretty easy and they're not going to be doing what we want them to do. So it kind of allows us to sort of check in and see how things are going.
And you get into bad habits when you do the same thing over and over. Bodhi, are you being camera shy? Oh, now you're going to come over here. Bodhi loves to just be part of the pack. Yeah, so when you're doing the same exercises over and over again, they can get stale, you can pick up bad habits, you just ultimately aren't going to... When I shouldn't even use that term. I know Dr. Jesse does the same thing, but when we prescribe exercises, they're not the kind that you would do to work out and necessarily improve your physique or things like that. We prescribe very specific, what we call they're prescriptive exercises. So they're really designed for a purpose, and there's a time and a place for them. So they do have to be progressed. you get into bad habits. You shouldn't be doing the same thing for more than a couple weeks, because it's kind of like when a doctor gives you medicine. Our medicine is the movement, so it needs to change. So that's another important reason, and you don't know when it's supposed to change or what to progress it to. Yeah. So how about some tips? So what have you been telling your clients for those that, obviously they're seeing you, 1 to 2 times a week on telehealth, but in between, what are you telling them to help their backs?
I think one of the biggest things has just been with regard to their workstations, to try to use a lumbar roll or something to sort of support their back. So that's our big goal in terms of just maintaining good curves in the spine when you're sitting for a long period.
So it's like a little roll that you put, I should have brought one, but you put it here in your chair, and so see right now I'm kind of slouching. The roll puts your back into the position so that it's nice and natural.
Yeah. And then just to get up and move, I think the biggest thing is you don't want to find yourself sitting for 30, 45 minutes to an hour and then realize that when you go to stand up, you're really stiff. So if you can find a place that you can go from sitting to standing and find a standing workstation. Sometimes a kitchen counter can work well for a standing workstation, not for a prolonged period maybe, but just to kind of give yourself a little bit of a change. I think like the bar height counter is probably the best, where you can sort of stand up nice and tall. And nobody's laptops are ideal, and that can be hard, but the key is just to keep moving so that everything doesn't get stiff.
Yeah, we recommend interrupting your sitting or moving around a little bit every 30 minutes or so. And a lot of people who do have standing desks think they should stand all day. Well, that's not really good either. Basically, anything that you do for a really long time is going to start to wreak havoc on your body, and your back is going to start to talk to you. Any other tips?
I think I usually tell people like the 30-30 rule. So 30 minutes sitting, 30 minutes standing, and then in between there, if you can fit in a few minutes of walking around, even if it's just around the house, is big. And try not to deviate too much from your normal exercise routine. So I know for a lot of our clients, what that looks like is they've been loyal Pilates clients and they love their Pilates. So they've been continuing to do their virtual sessions because they can't come into the studio. So even just having that regular routine, I think, is really important.
Yeah, our Pilates clients have been, even them, they were a little kind of skeptical to do it virtually, but they're all doing it. They're so thankful. They love it. It's been kind of fun. We have a pretty awesome community here, so especially the classes, they love seeing each other on the screen. It's kind of like coming to class, and they're like, oh, I get to see my Pilates friends. So yeah, absolutely. You definitely want to keep up with your normal routine as much as you can. Yeah. Anything else to add that you think is important for people stuck at home right now that are trying to not let their backs get stiff, or even someone who already kind of has an underlying back problem? Anything else that you want to add to tell them?
I think one of the biggest things is just sometimes with everything that's going on, it can be hard to think, beyond tomorrow, and it's just like a day-to-day kind of thing because everything's changing. But what we're trying to do here is think, what's 6 weeks from now going to look like for both us and for all of our clients. So, if you want to just hop on and talk to one of us, let us know, because we can really be a kind of source of logical support right now for you, just because we want to make sure that we can kind of get everyone through this without too much pain.
Yeah, absolutely. And if your back is hurt, if you're current client, you know us well, you know all the options that you've got. We kind of focused on that first. Our first couple of weeks after this all happened, our number one focus was on our family, our current clients. We wanted to make sure everyone was set up for success. Now that we've kind of passed that wave, everybody's rocking and rolling, we are now letting people who aren't our clients currently know that you can come and work with us. Like I said, we are open for in-person, but the reality is a lot of people, for good reason, are afraid to go out right now. So if it's not a severe case and you want to see if telehealth is something that could work for you, like Jessie said, you can go on our website and there's a button. I'll put the link in this post after we're done, but it says, I think, inquire about telehealth. Just click on that button, fill out the form, and then we'll call you, and we'll hop on for free with you just to see if it makes sense. At the very least, if you don't need our help, we'll tell you. If you do need our help, we'll tell you. It's really a win-win, and We also have on the website, I'll just put the link, it's cjphysicaltherapy.com in case I forget. I have a bad memory sometimes. There's also a link to download a free guide that we just put out. As soon as all this stuff went down, we immediately went to work and put out a guide. We're calling it our low back pain survival guide for people who are stuck at home. And Jess was actually in it. Her and my other Pilates instructor, Crystal, put some nice videos together for you guys, some basic like beginner Pilates flows and core strengthening and stretching and mobility type of stuff that, real short, like 5-10 minutes of that, real short, that you can do. It's free. You might as well download that for at home. But I think that's it. Anything else?
We have our health and
posture.
Oh yeah, jeez. We have our health.
I think I have awesome people that work for me. It's like I forget. Yeah. So a week from today. Yeah. A week from today. I'll put the link for that in this post too. A week from today. We have our back pain and sciatica free workshop. This was something that was already planned. We normally would do it in here. We're clearly not going to do that. But we're all set up to do it live. So we're not going to do it live on Facebook. We're going to do it through Zoom. So you need to register for a seat. And once you register for your seat, you'll get a link and you'll be able to join us. It's next Thursday from 6 to 7. And basically it's designed for people who, have back pain. Maybe they have sciatica. They're just not sure what to do. Do they need physical therapy? Should you do telehealth? Do you need to be going to the doctor? Can you just get away? Do you just need Pilates? That kind of thing. So we're going to be giving a nice presentation on why so many people get back pain. 4 out of 5 people suffer from debilitating back episodes normally. We actually think this statistic's going to go up because, I think everyone's going to have one by the end of this year because of all, the change and the stress and the sitting at home. So there are ways to prevent that and detect it way before you think, and that's what we specialize in here. So we're going to talk a lot about that on the presentation. We got a nice little PowerPoint prepared for you. It's real and it's free. And then at the end you'll have an opportunity to ask questions, anything that you want. And then if you do, want to maybe check out telehealth with us and see if it's an option, we will give you some options for that as well. And even if you're not sure you can make it live, the nice thing about doing this virtually is that if you sign up, you'll get the recording. So you'll at least get the information. So you should absolutely sign up and grab a seat. And then a week after that, we have our Pilates 101, Get Your Back to Health. It's our signature program. We do it 3 times a year. The enrollment, we've got spots. Usually by this time, the spots are filled, all of them. But we still have spots because obviously of everything that's been going on, people just are kind of paralyzed right now. But again, it's set up to do live. Just like we do our Pilates classes right now, you have an instructor, it'll be me actually, I do it along with one of my Pilates instructors, and we can see you on the screen and we're gonna teach you everything, and it's an 8-week program, and it teaches you how to use your core properly. I was talking to a woman the other day, one of her complaints was, she's super motivated, she's 67, she's so active, she wants to exercise, she wants to keep herself active, healthy, and mobile, but what keeps happening to her is every time she tries to push herself or do something, her back starts to hurt her. And what she explained to me was she felt like her brain didn't know how to turn her core on, and it kept turning her back on instead, and that is something that happens all the time. That's exactly who this program is designed for. Someone who just wants to learn how to use their core properly, so that even whether, it'll set you up for success to do Pilates, because we do Pilates here, but there is a learning curve to it. You can't just jump in and start doing intermediate Pilates. It is a progression to it. But even if you don't want to do Pilates, let's say you want to make yoga more effective, get that to feel better for you. Let's say you want your gym workouts to be more effective. The Pilates 101 program is designed for just that. It teaches you how to get in touch with your core, use your core properly, the right way. It connects it to your brain. Once you establish that connection, it's really hard to get rid of it. So that's what that program's for. It absolutely can be done at home. It's totally set up for that. So if you join our back pain and sciatica workshop next week, you'll hear more about it. But just go to our website. Everything's on our website, and you can just apply for that if you want to do it. But I think that's it. All right, that's everything. Got a lot going on. So cheers. Hopefully you guys are all staying safe. Cheers. We'll do our virtual cheers here. And